Breast cancer care is evolving rapidly, but one question remains at the forefront. How do we balance cutting-edge science with the deeply human needs of patients and their families? Dr. Carmen Calfa, a leading oncologist and researcher at Sylvester Comprehensive Cancer Center, isn't just asking this question. She's answering it through her groundbreaking work, from genetic risk assessment to survivorship programs. Her mission is as much about healing hearts as it is about curing disease. But here's where it gets controversial. Should every cancer patient automatically undergo genetic testing? And what happens when the number of survivors outpaces the availability of specialized care? Let's dive into her world and explore these questions. Dr. Calfa's roles at Sylvester are as diverse as they are impactful. As the Associate Director for Community Outreach in the Breast Cancer Program, she bridges the gap between medical advancements and public understanding. This means not only disseminating knowledge, but also listening, truly listening to communities' concerns and partnering with philanthropists who want to drive change. Then there's her role as Medical Co-Director for Cancer Survivorship and Supportive Care, a position she describes as the heartbeat of our mission. Here, the focus shifts from merely treating cancer to ensuring survivors lead fulfilling lives, whether they're in remission or managing chronic illness. Her leadership of the Genetic Predisposition Syndrome, GPS, initiative is a game changer for previvors, individuals at high genetic risk for multiple cancers. Imagine a clinic that acts as a one-stop hub for genetic counseling, surveillance, and preventive strategies. This isn't just proactive care, it's a lifeline. For example, someone with a BRCA2 mutation might face heightened risks for breast, ovarian, and pancreatic cancers. The GPS team collaborates with specialists to create tailored plans, ensuring these patients never face their risks alone. And this is the part most people miss. Genetic testing isn't just for those already diagnosed. Dr. Calfa advocates for broadening access, arguing that even past patients should revisit their genetic profiles as new mutations are discovered. When asked about her motivations, Dr. Calfa laughs. "I've been pretending to be a doctor since I was 3. My toys were stethoscopes and syringes." Her passion for problem solving, whether it's solving math equations or designing treatment plans, fuels her career. But the human connection is what keeps her grounded. "You have to listen to the story behind the symptoms," she says. Survivorship, in her view, is a lifelong journey. It begins the moment a diagnosis is delivered and involves not just the patient, but their entire support network. Her dream? A future where every survivor has access to holistic care. Medications, yes, but also nutrition, mental health resources, and even clinical trials exploring non-pharmaceutical interventions like exercise. Yet, challenges loom. With survivor numbers growing and a shortage of oncologists, how do we train enough providers? Dr. Calfa's solution: embed survivorship education into medical curricula and create training models for primary care physicians. Outside the lab, Dr. Calfa finds joy in simpler things. Knitting, she once made her own dresses in high school, boating with family, and working out. "My greatest gift," she says, "is time spent with loved ones." But let's pause and reflect. Should genetic testing become standard for all cancer patients, regardless of family history? And if the demand for survivorship care outpaces supply, who bears the cost of training more specialists? We'd love to hear your thoughts in the comments. After all, the future of cancer care depends on conversations like these.